once again our Sunday 9 p.m. live video. So today we have a series of topics all on menopause because of requests by one of you. So I have decided to come up with this topic, and it involves every one of us. Okay, some of you may think that it's still far away from now, but at least it's nice to know what we are going to go through and what we need to face when the time comes. Okay, so a lot of people know they have to go through this, but not many people think about it. And actually there is some of the things that I want to stress today is because in menopause a lot of people have a lot of misconception, and there are also a lot of wrong beliefs, and as a result end up with a lot of problem as well. Okay, so let's make a wild guess. How old do you menopause? Even this question, how old? A lot of people not even sure. Some people, when they come and see me, menses start to go disturb, haywire. Then when they ask me, doctor, why my menses like that? Then I say, going to menopause, so early Okay, so then I say, early meh? Already how old normal lah. But a lot of women think that menopause is a lot older. Okay, so but actually no, a lot of women don't actually know when is menopause. Menopause listen on average is 52 years old. 52 is the average age for menopause, but got younger, got older. Okay, so not only that, even some people sometimes, do you know that you can menopause even at the age of 17, 18, 20, 21? You can also menopause at the age of 68, 69, 70. It is so extreme. You can have people who menopause very, very young, and there are people who menopause very, very old. Because recently there is one lady, she has been going around seeing one doctor to another doctor because she got married and she cannot conceive. In fact, from the day she got married, her period start to become irregular. And then when she went and see doctor say she's going to menopause. And then when she came and see me, she actually menopause already. So that's why you can menopause at a very, very young age. So the good old advice that I give women all the time is, don't marry so late lah, marry earlier lah, don't choose until so difficult lah. Chin chai, find someone and marry young, okay? That is my general advice, because my biggest headache as a gynae today is women are just too old already when they got married. So they give us a lot of headache, okay? So marry young. So for those of you already married, if you have daughters, ask them to marry young, okay? Because women can menopause one. You know, there is a deadline, there's a deadline attached, and you don't even know your deadline is when. You don't even know when you're going to menopause. Is it 30, is it 40, or is it 25? Or is it 65? If you're going to menopause at 65, of course you can get married at 40 years old, so you can still have dozens of children, but we do not know when you're going to menopause, right? So on the safe side, please marry younger, okay? So menopause, there is no age attached to it. Average is 52. You can menopause very, very young. You can also menopause very, very old. Is it hereditary? No. Is it because your period came earlier, came later? No. Some people think that their period come early, they'll menopause early. Period come late, menopause late. No. Some people like to come and tell me, and they're comparing themselves with their sisters and mothers. No. Menopause age is also not hereditary. Because I know my family, I got so many aunties. I got one auntie only, almost 70 years old, only menopause. Okay. So is menopause early better or later better? Answer is both also no good. A lot of people think that the older they menopause, the better. Because a lot of people say that when you menopause, you faster grow old. You grow old faster, you got a lot of old people illness. True. So they want to menopause later so that they can keep themselves young. But the older you menopause, the more young people problem you have. So it's no good. The younger you menopause, the faster you grow older. True. Because after you menopause, all the old age things start to come. All your pain, your osteoporosis, your bone problem, your heart problem, your brain problem, your skin problem, basically everything start to age faster. So your whole body start to age faster. So you have a lot aging problem. But if you menopause late, then you are more at risk of diseases linked to hormones. Like you will have more fibroid problem, endometriosis problem, ovarian cancer, breast cancer, uterus cancer. Also no good lah. I also don't want to menopause so late. So the best time to menopause is around the average age between 50 to 55 because average is 52 ma. So somewhere between 50 to 55 is the best time to menopause. Don't want early or don't want late. Okay? When time comes, time to go, time to end, time to stop, time is right, that's the best. Okay, so now we know that menopause actually causes aging. But if you don't menopause, that also no good because all the young people problem will come and still continue to be at risk for you, which is all the cancer. So we know that women who menopause early also no good, menopause late also no good. Okay? So the best is to keep it at average age. If you're going to menopause late, then of course there's nothing I can do lah, right? But if you're going to menopause early, then it's better you take some form of hormone to keep you not menopause until you reach 50. This one also some people will have a lot of fear. I talk about it later. Okay, we have one more lecture, one more live talk just on to take hormone or not to take hormone. So how you know when you're going to menopause? Number one, for those of you all along your period is regular. When your period start to become irregular, then you have to start thinking, am I going to menopause? Because 3 to 5 years before you menopause, that is before menopause, your period will start to become irregular. And some people can be up to 10 years. So if you are like 43 years old and your period is a bit irregular, and then you come and see gynae, and gynae say, I think it's because you're going to menopause, and then you worry, so early No lah, not early anymore, because your period should be irregular in your 40s already. Because it can irregular for 3 years, 5 years, 8 years or more. In your 40s, it should start to become irregular. If in your 40s, your period is still so regular, I am a bit worried that you are going to menopause late. So if your period is irregular in your 40s, it's actually normal. Chill, don't worry. It is on the right track. So the first thing you will see is period become irregular. But some women, they don't face that. They just find that their period getting shorter and shorter and shorter and shorter and shorter. The amount of period getting less and less. The number of days period getting less and less. And the gap between one period to another period also less and less days. Instead of 28-day cycle, become 25, 24, 23, 22, 21, or even 20 days. Every 20 days a period come. This is also can be due to going to menopause. So it just become less and less and less and less and less and less and less. And one day it will decide to stop. So when is it that we say you menopause? You have to stop 1 year. 1 year no period, that is the definition of menopause. To say you really menopause, you need to have 1 year no period. So after 1 year no period, that is when we say you menopause. So menopause should be around early 50s. That is the right time. Okay? What other things can happen in menopause? Patients like to ask this question. What should I expect out of menopause? What should I look for? I will say, don't look for anything lah. After nothing happen, also you imagine. Because it's true. Sometimes you don't know. Menopause go on smoother. When you know, then you start to imagine, is this hot flushes? Is this what? Is this what? Is this what? Wow, all kinds come in. Okay. But roughly, I just let you know. Because why we say that is there are some group of women, maybe they're on some hormone. Some hormone therapy hardly got period come on. So let's say if you're on like Mirena or Depo, or some of the hormones that for contraception, you just use it just to prevent pregnancy. So for those of you who have not heard what is Depo, what is Mirena, please go and see my video. Go and subscribe my YouTube channel, Dr. Tan City Clinic, which is the link in this post, and look for birth control. So there's certain birth control that you hardly got period on. So let's say you hardly got period. So these women will realize one thing. They menopause very smooth one. They menopause very smooth because they hardly got period. Most of the time they got no period. They menopause until they don't know. When you menopause until you don't know, you're very happy one. You're still very happy one. Women who know they are going to menopause are the ones that are not so happy because they end up emotional lah, depression lah, cannot sleep lah, hot flushes lah, headache lah, giddiness lah, bone pain lah. So one thing we know, one thing we do know, how happy are you when you menopause and how much suffering you have when you menopause. So menopause can be actually so smooth. Menopause until you don't know, that is the best. On the other extreme, there are some people who really suffer. Cannot go to work, cannot sleep, so emotional, so depressed, so much pain everywhere. So who have a good menopause and who have a bad menopause? The first group of women who don't know that they are going to menopause usually have a better menopause. So it's better don't want to know. Then your menopause is so smooth. So if you can be on something that controls your hormone until you menopause, until you don't know, like Mirena, like using Depo, Implanon, or even contraception like oral contraceptive pill that make your period come every month on the dot. So even if you're going to menopause, you don't know because your period still come every month on the dot. These type of people tend to menopause happier. But maybe because there's hormone in their body lah. That could be due to one reason. Another thing that differentiates this group of women, so I'm sure every one of you want a happier, smooth and easy menopause, right? Nobody want to suffer during the menopause. So the key is stress. Are you having a stress-free life all your life? If you're happy from the day you're born until the day you menopause, I tell you, your menopause very smooth one. But are you very stressed? Always very stressed. Always very emotional. Always easily angry. Always easily bad temper. On and off cannot sleep already even before your menopause. Always fighting for deadlines. Always feeling very stressed. Then your menopause usually will be more horrible. That because we know that women who find their menopause horrible, for example, my menopause is horrible. How to solve it? Simple. We say, go and jog every day lah, then your menopause problem will settle. What does jogging do your menopause? Does it stop you from menopause? No. Jogging relieves stress. Go and learn yoga lah, then your menopause will be smoother. What does yoga do to you? Yoga relieves stress. Go and meditate lah, then your menopause become better. What does meditation do to you? Release stress. So same, anything that can reduce your stress will make your menopause better. So simple, no stress, no suffering. Menopause is a natural process. Menopause is just a natural process. Same like if you watch my video on postnatal depression. Same. I will say why women become very much emotional after birth. Why do women become very much emotional during menses? It is the same reason. Because when your hormones go up and down, up and down, up and down, women are more susceptible to stress. That's why men can never understand. Men can never understand. Because men got no hormone go up, go down. They can be everyday stress or they're everyday no stress. Women can be everyday no stress except during some time only stress. Okay, so, or women can be always stressed but sometimes more stress. It's all due to our hormones. When our hormones go up and down, up and down, up and down, we are more susceptible to stress during certain phases of our life. That's why we are more likely to get depression, anxiety during menses, before menses. We are more likely to get depression, anxiety after we give birth. We are more likely to get depression, anxiety during this menopausal phase. We call menopausal phase because it's not just one day. It is from the very beginning when your periods start to become irregular, that already start. We call climacteric. Climacteric is the duration of time from the beginning of the time when your period become irregular up to the extent of your actual menopause. That is the climacteric phase. This phase is really crazy one. You know why? Your period will be irregular for 2-3 months. Then after that regular back for the next 6 months, 8 months. And then after that irregular again for 2-3 months and then regular again for the whole year. You see, your hormone is really crazy. One day up, one day down, one day normal, one day not normal. It's so crazy. So that is why if your life have been stressful, this is the period that you will end up having a lot of problem. Cannot sleep. Actually having depression, anxiety, bad depression, bad anxiety, cannot sleep, so emotional, everything, every day bad temper. Your family also scared of you, your husband scared of you, your children also scared of you. Most of the children at that time already in their 20s, or late teens, they just bear with you. But actually they're so scared of you. Some of you could not work because even your boss you scold. You never scold your boss, but in your 40s you scold your boss. That is because you cannot control yourself already. So it all happens is because there's stress. Your boss don't give you stress, why you scold your boss, right? But your boss give you stress, you cannot control. In your 40s you scold your boss. Okay? So it is all still back to stress. So you want to have a happy menopausal phase. It's very important. You need to have happy life, stress-free. Do something to make sure you have no stress. Exercise is one. Jog every day, every other day. Join marathon. Train yourself for marathon. Go and climb hill, climb mountain. Train yourself to climb. Swim every day, every other day. Take up yoga lessons. Join yoga group classes. Join Pilates. Join yoga. If not, go meditation. Or, of course, I like to say, see my therapist lah. Okay? See my therapist because my clinic got therapist and my therapist is very good at solving all these problems too if you cannot solve on your own. Okay? So, women who come to me, who tell me they cannot sleep in their menopause, I will say, go and see my therapist. Solve your problem. Just see lah, tomorrow can sleep already. Actually, sometimes it's just as easy as see one time and then after that can sleep already. So why you don't want to see, I also don't understand. So go and see my therapist. That's one way. See any therapist also can. That's one way. But don't go and take sleeping pills, okay? Don't take sleeping pills to solve your menopause sleeping problem. Because number one, this menopause sleeping problem is temporary. But temporary is like 3 to 5 years. Not easy to go through. But sleeping tablets is addictive. These 3 to 5 years, you go and take sleeping tablets, you end up taking sleeping tablets for the next 40 years of your life. Don't do that. Okay, you either go and exercise or you go and see my therapist and solve all your problem, or you resign from your job. Early retirement. That is one way if your stress is your job lah. If your stress is your husband, is your children, then of course you have to see therapists on how to get rid of your husband or your children. It's not possible, right? So that's why there are people like therapists who's there to help you lah. Okay? So that is the most important thing you all need to know from today's lecture, today's talk. Another thing is, what are the things that you just need to watch out for is your bleeding pattern. And something I very worried when it comes to women who menopause. I very worried because they will blame everything to menopause. My period irregular, I never see gynae. Why? I think it's menopause lor. My period got problem, I never see gynae because I think it's menopause lor. And then they think, and they wait until something not right, then come and see us. It's usually too late. Because when period become abnormal, the first thing we worry is actually uterus cancer. We worry uterus cancer, and I have quite a number of women who do that. They think it's menopause because my sister say it's menopause, because my neighbor say it's menopause, my everyone say it's menopause. So I just tahan and see what happen, hold on and see what happen. Or some of them even go and see Chinese sensei and say, I think I'm going to menopause, maybe I want to take something to regulate back my menses, regulate my body. But for months and months they take, and then it doesn't work, and then they come and see gynae. Too late already. You must understand, if you watch my video on uterus cancer, please go and subscribe to my YouTube channel and look for uterus cancer. You will know one thing, that I have already mentioned in my talk regarding uterus cancer. That is the best cancer to have in life. Why best? Because they show early sign before become cancer. Months before become cancer, he tell you already. Your uterus will tell you one, because your period not normal ma. But you never come and see doctor. Then how to prevent the cancer when you never come and see a gynae, right? So don't. Abnormal menses, even if you are going to menopause, you still need to see a gynae. You need a gynae to tell you your menses abnormal because of menopause. Then only confirm your menses abnormal because of menopause. Okay? You cannot be your own doctor. Your sister cannot diagnose your menopause. Your neighbor cannot diagnose your menopause. You know, even you ask me, Zhongyi also, your Chinese Zhongyi also cannot diagnose your menopause. You have to see gynae to make sure you are not cancer first. Doctor say you're not cancer, it's definitely menopause. Then menopause lor, then you go and see the Chinese sensei lah, go lah, no problem one. But first, gynae must say it's not cancer, it's menopause. Then only you can go and see your Chinese sensei. Understand? Don't just say it's menopause and go and see on your own, okay? Never do that, because that is the most worrying thing lah. Okay. Then another thing is, after menopause, that means 1 year no menses. We say menopause is 1 year no menses. After 1 year no menses, then forever cannot have menses. Even little bit also must fast go and see gynae. Okay, that can also be a sign of uterus cancer. So, and usually when little bit only is not cancer yet, so you must fast go and see gynae. I always worry women always wait and see one. They wait and see, especially all the auntie, they will wait because they don't know how to drive. And then they want to see when their children free. Then sometimes they see their children always busy, they're not there to ask. And then they wait already 3 months, 6 months, still bleeding only, they tell you. Okay? So, remember that after menopause already cannot have any bleeding. Little bit of bleeding also must see gynae fast. That part I know, they know it's not normal, but sometimes there's a delay. The one I scared is those 40 over years old women. They always think their period problem is due to menopause. No. Normal healthy women, when they menopause, number one, the period is irregular, but when the period comes, it is still a normal period. That means it should not last more than 7 days. It will still be like 3 days, 5 days, 6 days, and it will stop. And the flow cannot be heavier than before. If it's heavy, don't know how to stop, all those cannot say it's menopause. Must go and see gynae. Okay? So many gynae everywhere. Go. Cannot afford private, go clinic kesihatan. Sure, they will send you to go and see the government gynae one. Okay? So that is the most important thing you need to know. So that's all I have to say for today's talk. So this menopause is going to be a series of 3 different talks, and all cover different aspects of menopause. So today's talk is just the introduction. So remember, menopause average at the age of 52. To say that you menopause, you have to have no menses for at least 1 year. But even though it's 52, you can menopause at the age of 20. You can also menopause at the age of 70. It can be any age. So for those women who are not married, please marry early, because you can menopause any age. Don't marry only after you menopause, okay, because women have done that. Don't do that. Always marry early. That is very important. Okay? So if you have any question about menopause, please put it up in the comment section. You have any more topics you want me to talk about, please post it up in the comment section also. Okay? So let's see what you have for me today. For those of you who haven't subscribed to my YouTube channel, please subscribe. I have so many topics there already. Since the beginning of MCO, we have been doing this live video almost every week. Initially, actually, I have twice a week. Now it's once a week. So please go and see my videos. There's so many videos up now. This topic is actually a very important topic for everyone. So please share it with any of your friends. Actually, just share with anyone. Everybody should know about menopause, okay? And menopause can happen to anyone at any time. Lee San San asks, can we actually control how old we get menopause? We cannot control, because something that happens eventually. We always say that, in simple words, I always like to describe, each one of us are born with a certain number of eggs. Eventually, all the eggs will either be used up or die off. So somebody was telling me, if I don't ovulate by taking contraceptive pill, can I delay my menopause? Also no, because even if you don't ovulate, your eggs will still die off one. So eventually, when all your eggs die off, you menopause. So as simple as that. So there's no way we can control our menopause age, but we can only delay all the complications of menopause if you continue to take hormones. As long as you don't take hormones when you menopause, then the complication of menopause will still come in. But to take or not to take, I will cover this topic in the later talk, okay? Next 2 Sundays, I think it's the last talk. Catherine asks, I had menopause after hysterectomy. Hysterectomy is a surgery to remove uterus, but have sleeping issues. How can I see your therapist? Or you want to see my therapist, just make an appointment. I think, I like to guess. I better don't guess again. I know their phone number starts with 016. I'm bad at remembering phone numbers. My clinic has so many phone numbers that now I cannot remember all of them already. Every important staff has her own number. Okay, to make appointment to see my therapist, please WhatsApp to 016 336 7612. 016 336 7612. Okay, so please WhatsApp to my staff so that you can make an appointment to see my staff. You can see my therapist. That is one way to help you with your sleep. Catherine say that, will the anxiety and sleeping issue get better? I had my hysterectomy in 2016. Of course, it can get better. The only question is, we're not sure how many sessions you need to go, depending on how bad. I have certain women who come to me just for a short duration. They never had sleeping problem all their life, but maybe they have this sleeping problem for the past 2-3 months only. These people very easy to settle. 1 session, 2 sessions also sometimes can settle already. No big deal. But some women, they come and tell me that they have sleep problem over the last 5 years, 6 years. Then this type of problem doesn't solve in 1-2 sessions. You may need 4 to 8 sessions, minimum 4. Some go up to 8. But after 4-5 sessions, most women will see improvement already. They cannot sleep for 5 years and now they can sleep better. Of course, by the time they finish like 7-8 sessions, definitely their sleep have improved tremendously. We can help up to, you ask me, 70-80% it's definitely possible one. For some people who only manage to sleep 2-3 hours a day, now can sleep 6-7 hours a day, is already a big improvement. Definitely can help. But the only thing is you need to have enough sessions. Sometimes some people just come 1-2 session and then just went off. That very hard lah. This is not medicine. I give you a tablet, you sleep tonight. Therapists need time. But if your sleeping problem is just short-lived, it's very fast one. Especially those pregnant women, because sometimes pregnant women all along no problem. Pregnant women like to think a lot. So when they think a lot, they cannot sleep. They want to see one time also can sleep already. I always tell them, you go and see today, tonight you get to sleep already. And true enough, most of them after see my therapist once, after that they can sleep already. So sleeping is actually something quite easy to solve. Peng Lim said, I was told that the more ovarian surgeries we go through, the less eggs we preserve. Does it mean women who went through more surgeries will get menopause earlier? One thing we know is if you remove the entire one ovary, not two, one ovary, then it may affect your menopause by only 1 or 2 years only. Actually, not a lot earlier. It's not like half, you know. Now say, let's say I'm 40 years old, maybe I'm going to menopause at age of 50. Now I'm 40 years old, take away one ovary, so I menopause at the age of 45. It's not so simple. Because the eggs actually is not like how many times you ovulate, you use up. No. The eggs actually also die off slowly with time. Actually, there are a lot more extra eggs in the ovary one that never ovulate one. But it die off slowly with time. And this thing has nothing to do with your surgery. So at the most, they affect also 1 or 2 years only. So no big deal lah actually. Unless during your surgery, you already destroyed the entire ovary. So if you destroy the entire one ovary, then you only left one ovary. Then it will affect 1 to 2 years or so lor. But if you accidentally or deliberately destroyed both ovaries, then of course you menopause immediately after your surgery. This is a very important thing because endometriosis, sometimes some women with endometriosis keep going for surgery after surgery after surgery after surgery. And when they have too many surgeries, sometimes I also tell them, you know, maybe after this surgery, when I take out all your cysts, there's no more eggs left and then you menopause immediately, which is something can happen one. That is why, very important, you must make sure after your endometriosis surgery, your endometriosis don't grow back. Women should only go for 1 endometriosis surgery, not 3 or 4 or 5. But again and again, people are going for 2 or 3 or 4 or 5. I just want to sigh because whenever they end up with a second surgery or third surgery, you see their story is so typical one. Please go to my endometriosis videos to understand more. I already have these videos, a few videos in fact on endometriosis in my YouTube channel. So go to my YouTube channel, subscribe to my YouTube channel and go and watch all those videos linked to endometriosis. And then you will understand why your endometriosis grow back. Sure, you got something never do. And if you never do something, your endometriosis grow back, then you have to have second surgery. What to do? If not, you're still not pregnant. What to do? We have no choice. We don't want to do so many surgery for you. But because you allow your endometriosis to grow back, I always sigh when I say that. Because there are just too many women out there and they like to, you know, they typically, women come to me on the second or third surgery or fourth surgery or fifth surgery. Please, I don't like, because I feel very sad that you went through so many surgery and you still do not know how to make sure your endo don't come back. I also got endo surgery 20 years ago. My endo never came back. So you must know how to take care of your endo. Please go to my endo video, okay? Fatih Nashra say, is it true who have done ovarian drilling will experience earlier menopause? No lah, drilling that little bit is not going to make a lot of difference. Remove the entire ovary, also menopause earlier by 1 or 2 years only. That few little holes is not going to make a lot of difference. Maybe give you 3 months, 6 months earlier. Hiya, no big deal. Joy asked, during my last laparoscopic surgery, my endo specialist told me that one of my ovary is too small and I also have endometriosis. What will that cause me to have earlier menopause? Not necessary. If one ovary already gone, left one ovary working, then you earlier menopause by 1 or 2 years law. Same principle. Okay? But as long as you're still having period after your surgery, that means you're not yet menopause. The risk that endo patients have is when they do a surgery, after that they totally got no menses anymore. They menopause after the endo surgery. This one usually happen if you have too many surgeries. So please don't go for so many surgery. Please, 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 please always know how to prevent the endo from coming back. Okay? Of course, I don't blame them. Usually, they always say nobody advised. Yes, nobody advised. But now it's 21st century. People don't wait for people advice. All of you know how to Google, go here, go learn, go this, go that. So, best is you must know yourself okay? So, please, 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 please. We already know how to make sure endo don't come back. So, please go to my YouTube channel and see the videos on endometriosis and make sure you are on the right track to make sure that your endo don't come back, so you don't have to have repeated surgery. Then you don't have to worry so much about you menopausing earlier. Okay? Alright, but as long as not too drastic things happen during your surgery, you should not menopause so much earlier after a surgery. The most give you is 1 to 2 years earlier only. Okay? So that's why women with only one ovary can still menopause in the 50s one, because it only bring them 1 to 2 years earlier only, not that long Okay, so don't worry so much. Okay? Alright, so because for me, I also have endo surgery. I also have ovarian drilling. And now I'm already in my late 40s. And my menses is still coming like normal. So I don't think I'm going to menopause early also. So, alright, so don't have to worry about all these things. Okay? So I see that's all the questions you have for me today. So I'm happy that you stay tuned to my this Sunday live video again. As usual, I'm going to mention again, this is a series, just like my last series. So it's 3 talks on 3 different Sundays, all on the same topic. Different aspect of the same topic. Okay? So that's all for now. Thank you for staying tuned. Thank you. Bye bye. See you next week, Sunday 9 p.m.